just barely made it through my review at medical school, right? So, because they thought it was just too weird, right? But cat brains are more readily accepted. But anyway, he drops Groff's papers on me. He said, "Oh, you'd be interested in this." I said, "I didn't know why I'd be interested in this, but I read them and I was." So, and the LSD psychoanalytic studies, they go through Freudian phases, so personal biography, and then they go through a death rebirth thing, where they totally fall apart. And indeed, if you're a neurotic, you have to be hospitalized. If you're normal, you get pretty neurotic. If you're psychotic, you go back to the back ward, because you get really wild, right? And then they'd have a death rebirth experience. So it was Freud and then something called auto rank or birth trauma. And then it came up, got it together in a Jungian framework, which Groff says in those early papers he resisted because it was all this archetypal mythological stuff, right? Or the collective unconscious, right? Like Greek myths, like Vedic myths, all that sort of stuff, right? From anything from anywhere. Didn't matter what your background was. So in any case, he had about, total, before he had to retire to Essen, he had about 4,500 case studies. When he came to the United States, he had about 3,500 in his suitcases, right? And out of that data, he came up, as a psychoanalyst, psychoanalysts like to go back to earlier experiences, being the root cause for later experiences, right? So, you had trouble with your brother or sister, or you're envious of boys because they had penises, or you had a bad breast experience, whatever, that type of stuff. Well, with that same mindset, he came up with intrauterine problem. Right? Let's not stop at birth. Let's go earlier. Right? And so he came up with 4 perinatal birth matrices, which are the obstetrical 4 perinatal birth matrices. Right? So you have intrauterine experience. Right? You have labor. You have passage through the birth canal, and you have birth itself. And he would rephrase these on the transpersonal or mythological level as intrauterine heaven, right? Which is what Freud said. Freud thought that spiritual experiences were regression to the womb. Right? When he was confronted by Roman Roland, who was a French intellectual, about a guy named Ramakrishna, Freud got very upset about all this and had to figure it out. That's where the book Future of Illusion came from. And he actually states, these sound like regression to the womb. Well, it might be true, right? It's very heavenly, oceanic, everything's fine. Unless, of course, it's disturbed. We'll talk about that too. And you have just the opposite. I call these emotional seasons. Summertime, cotton's high, mom is good looking, fish are jumping, that sort of stuff. And then you have, autumn, everything dies, it falls apart, things turn cold, right? So 300 pound, mama, by the way, the uterus is the strongest muscle in the body, sorry guys, puts about 300 pounds per square inch out. Right? So it's a real vice, right? And we've all been through it unless you were a C-section, and then you had probably a few of these, but not much. So 300 pounds per square inch until you're born, right? So it's basically hell, no exit, Sartre called it, right? And it's like not much fun. I mean, the blood's getting cut off, you're getting squeezed, meconium's coming out, all this. It's not a very pleasant experience. And then the cervix opens, and the baby starts to travel down the birth canal. Well, the baby's a lot bigger than the vaginal tract, and it ain't easy, right? But you got 300 pounds per square inch pushing you forward. Sometimes the babies, if they're not drugged, are pushing out to try to get out too, because they realize there might be something less resistant as they go along. The blood's getting cut off on the cord, all that sort of stuff. It's a real struggle to survive. Okay, high drama, right? It's straight out of Hollywood, right? So high violence, high sex, all that sort of stuff. Women have orgasms during birth. Babies come out, male babies come out with erections. There's blood, feces, urine, all kinds of wonderful stuff, right? It's like, whoa, right? heavy doing, and then all of a sudden the whole fetal world gets destroyed. So, what do they call that night where, you know, the dramatic Teutonic world gets destroyed by the fiery wolf? What? Gotterdammerung, right? So the whole world gets destroyed, right? And this whole thing of blood and guts, and you're born, right? The fetal world is completely different than the baby's world, right? So it was a wet, dark world, and now all of a sudden you step into the light, no boundaries, it's dry. One thing that we generally don't talk about is that the babies have no keratin on their skin. Right? So it's not like this skin, it's like the skin is like the conjunctiva of the eye. So even the swaddling clothes are very, very difficult. The Buddhists talk about that, how painful it is just to have cotton cloth on the baby's skin. But also going through the birth canal, the conjunctiva of the eye, if you rub it against even some mucous membrane, it's either going to go inflamed or it's going to go really cold. So themes of fire and ice, typical hell or purgatorial types of issues. Okay, so any questions on these 4 seasons? Summer, fall, winter, spring. Right? This is the essence of what we're talking about, right? And indeed, there's a guy named Metzger who wrote an LSD guidebook with Timothy Leary and Ram Dass, and it was all based on the Book of the Dead. Anyway, I talked to Metzger at a transpersonal conference in Europe. He said, you know, I never understood why when I did LSD, I kept on getting beaten up all the time. All these people are having blissful experiences, and I'm getting beaten up. And until I read Stan Grof, and then it made sense. Right? So a lot of people don't realize that when they take psychedelics, they're on the road to hell. Right? I mean, it's only worthwhile if you're on the road to hell and you can go through hell. When you go through hell and you come out of it through a purgatorial experience, then all of a sudden you might be in a much better space, free of your past complexes, so to speak, free of your conditioned mind. Right? That's where we're going with this next. Right, but let's just talk about a little bit of the birth matrices. So he actually correlated, different problems with different birth matrices. Intrauterine experience, right? Mystical feelings, union, encounter metaphysical forces. If it's disturbed, it could be evil forces, right? So if there's some type of, uterine distress, etc., then that can be seen as very nasty, deep metaphysical, evil kinds of things. Labor, right? So, alcoholism, drugs, feeling stuck, hypochondriasis, feeling very depressed, inhibited, just, there's no point to all this. Mom, what did I do to deserve this? Right? So it's just like the walls are caving in on you, right? Then you have passage through the birth canal, associated with, various sexual deviations, obsessive compulsive stuff, asthma, tics, conversions, anxiety, impotence, neurasthenia, traumatic, different migraine headaches, enuresis, etc. Right? Lots of somatic things related to the high tension of that. And then you have actual liberation or birth, and obviously more mystical union stuff, metaphysical forces. If it's disturbed, somehow the birth, you come out with an Apgar of 2 or something, it might be sort of, you might associate that with more evil types of feelings, right? Like, I'm in this new space, but it ain't pleasant at all. I'm just barely surviving. Right? So you might have hypomaniacal, different kinds of hallucinations, daydreams, etc., mixing up reality and your visions. Right? Well, that's all because psychedelics, meditation, chanting, trance dance, inhibits the default mode network. So Cathcart Harris did the first functional MRIs with psychedelics in 2011, published around 2012, 2013, and he found that it takes this network offline. And this network is what It's going on all the time in your brain. Right? You could say it's your ego. If you had a place for the ego, it's the ego. It's your conditioned mind. It's what keeps you focused from one thought to the next, and it connects the thoughts, lets you get from point A to point B, organize your shopping list, all that sort of stuff, right? So this basically goes away. This activity goes away when you do psilocybin. He found that. This was initially discovered by one of the guys at my training program at Washington University, a guy named Rachel, and he coined the term default mode network in 2001 to describe the resting state of the brain. In other words, when you're doing nothing, no focused activity, you're still thinking, right? And that thinking has some activity in different parts of the brain. Initially they thought, oh, it's just the blood flow, but no, it's actually glucose, utilization, etc. So actually the nerve cells are active during this period of time. Okay. So, and apparently it looked like it was suspended during specific goal-directed activities, but actually no. The goal-directed activities have 5% more glucose utilization than the default mode network. So your thinking mind, right, resting state thinking mind, when you focus on something, there's some more parts of the brain involved, but it only raises the whole activity of the brain by about 5%. Right? So focus, this is the basis of your ability to think and focus, and then when you think and focus, you use a little more of the brain, but this actually is what's going on. Huxley, our first topic, describes something called the reducing valve. Right? That the reason one did not have visceral experiences all the time is because the brain reduces the input to just a trickle. So that you just have, sort of sequential, or maybe not sequential, but some type of thoughts somehow connected, some kind of chain, condition, right? Constructs, and that's related to your default mode network. So you take the default mode network offline, and therefore you have no reducing valve, or voila, you have all this input from the brain as opposed to just a trickle. And that's what psychedelics give you. So you look at a flower, or you look at, a crease in your pants, and you can see all kinds of things. Or you can go into, ecstasy, you can go into hell, you can go whatever, right? So the default mode network seems to be the way psychedelics work, seems to be the way meditation works, seems to be the way trance dance works, or sensory deprivation, or all those things. So when you get beyond, the whole idea is the ego can't do these states. That's been traditional in all yogic or mystical traditions, right? You have to sort of let go of your ego being in charge and turn it over, a la 12-step program, right? The only way to get anywhere in the 12-step program is to turn it over. And unless you have an experience of the divine, you're not going to get anywhere. That's the basis of it, right? It's probably true, right? A guy named Miller did some studies of, he was the big interview fellow, what's it called, where you decide whether somebody's ready for therapy yet, or,
Motivational interviewing.
What?
Motivational.
Motivational interviewing, right. So Miller came up with motivational interviewing. He was also very interested in spirituality, and he did a study of counselors at alcohol rehab centers. They published it in the Journal of American Medical Association as a null result. Did absolutely nothing. Spiritual counseling did absolutely nothing for the alcoholics in these programs. Compared to the control groups, you have all the spiritual counseling you want. However, one spiritual experience changed their values completely. Different for men and women. Women had a different set of values than men when they had the spiritual experience. But one spiritual experience, then they had the change that the 12 steps talks about. So they're pretty accurate on that. They got that one down. And he presented that data. It's just fascinating that it doesn't matter what the default mode network wants, unless you get rid of it and open up, you really don't change. Right? So, okay, so we have Dante. So what we just described, if you remember, is Dante. There's a, Commedia Divina, right? It talks about, heaven, hell, purgatory, and this mystical rose, right? Total liberation, right? So, and Dante got it from the Islamic scholars, right, in Spain. This was just not Catholic Europe. This was also, the whole Muslim world back in 1200s, right? So, Dante's teacher was actually a translator of the Quran and other mystical Islamic texts. So this is essentially this whole idea of these heaven, hell, purgatory, and liberation are found in many places. I wonder why. Maybe Goth's birth model applies, but they're through most cultures, not in westernized industrial cultures, but most cultures of the world have something like this. 80% of the 500-something cultures studied by anthropology have practices that talk about these types of states. So, and you can get heaven, or you can get hell. Notice that from the outside, this might look like a cervix. Right? So the head getting jammed, into the cervical canal and going deeper may indeed be a nice metaphor or experience of a hellish domain. I didn't do the purgatorial stuff or liberation, but that's essentially the idea with psychedelics. So if you do psychedelics without a psychotherapeutic support that uses a model similar, it may not be exactly the same model. I mean, there are lots of, there are 500 something, probably 400 cultures have somewhat different models. The Navajos might not do it the same way as, the Amazonian Indians, something like that, or the Sioux do it different from the Navajos, or Christians do it different from the Sufis, or whatever. But they're very similar, right? Very similar, and that you have similar kinds of experiences. They may change the names. You might not have the white buffalo. You might have, some Michael the Archangel, whatever. I mean, you might change the name, so your cultural context may indeed filter the archetype. Jung talked about that. So you have archetypes, which are energies behind these forms. They take form according to your culture. Right? So they have multivalences, and they can express themselves in different ways, but they clothe themselves with basically what you're familiar with when you come back to your default mode network and try to explain it to people. And most of the time when you try to explain this stuff to people, they think you're nuts. Right? And of course, you may be nuts. Right? So if your default mode network, and the default mode network is thought to be involved in schizophrenia, depression, PTSD, autism, right? And Alzheimer's disease, right? So if your default mode network is defective, if you have some gaps or some loops in it or whatever, the unconscious content of the brain, the rest of the brain, filters through, and it can be really chaotic, right? Or maybe it's structured according to the particular filter it's going through, but it's like that. So, any questions on that? I think that finishes content. Any questions?
Well, I just think it's interesting that I see it just in popular news that psychedelics are maybe being revisited as therapy, and I know of a friend whose adult alcoholic son had a terrific response to going to a program with Ibogaine. And so that's, I'm just very impressed by that. And,
yeah. And one of the things that Ibogaine is famous for is immediate death rebirth experience. I mean, it's like when you take it, you're gonna, have a complete falling apart. I mean, that's just like, that's what's going on right away. There's nothing gentle about it. You don't go through a number of things like you might go through LSD before you finally fall apart. It's like bam. So in a few sessions, you're like, went through this whole idea of death reversion, and you're basically free of some of your conditioning. And you're in the way your default mode network has constructed your conscious mind. Right? And indeed, Portugal, actually the latest model of addictions is not the drugs cause the addiction. The latest model is that the drugs salve the addiction, that's why you get addicted to them. Right? Okay? Your addiction is to pain, and you're looking for something to relieve the pain. So if you have a rat in a cage, and you only allow it to have water and opium, it'll die in the opium. That's the old model, pre-1990s. Right? If you have a rat in a cage with other rats, doing things rats like to do, and you have opium and water, they ignore the opium. Right? So it's trauma-based. Right? Portugal put that in 2001, since they had the worst drug problem in Europe, and they eliminated all the laws. There are no illegal drugs, they're not criminal drugs rather, in Portugal, and they just focused on rehab, since that was the problem, right? And guess who has the lowest rate of drug addiction in Europe?
I'm betting Portugal.
Yeah.
Yeah.
So it works, right? Completely different model, and they don't see drugs as the problem, they see the person having a wound that's trying to solve it with street drugs. Because most of the drugs we use in psychiatry don't really help until we get ibogaine and things like that legalized. Psilocybin might help. LSD obviously did help, but that might be coming too. But I think Israel might be legalizing LSD therapy soon, and a few other countries, we might be there soon. I think in Jamaica, one of these, I think psilocybin therapy is legal in Jamaica now, right? And FDA may approve it here next year, completed phase 3. So we will be hearing more about these types of things soon. And by the way, all that stuff, all the stuff that happens with LSD also happens with breath work. With or without music, a la Stan Groff, but when I trained with Stan Groff, and the text we used was an LSD text, and the text was called The Adventure of Self-Discovery, and it was the text for breathwork and LSD, and there was no distinction between experiences. And nobody can believe a little bit of breathing, a little bit of music will trip you out, but it does.
Okay. In a bad way as well? Like
all the ways.
In all the ways.
All the
okay.
ways. Yeah. And actually, this is the oldest therapy in the world. Probably, at this point, that's what it's thought. It's been going on for 70,000 years among the San people, the Kalahari Bushmen. And they do a little trance dance with a little music, and they trip out, and they visit God, or they become a star and hang out with other stars, or they heal the tribe. So Kundalini type of experience, and they describe just like the Kundalini yogis with hyperventilation, but they're doing a repetitive dance. And they talk to animals when they're killing them. They do all this. I mean, and they can find water where there's no, when the desert's all dried up. They know how to find. They can tell where the water is, and the bulbs and stuff. So, and there are YouTubes on the Sand People you can see. I actually gave this talk in Europe recently. No, I didn't give a talk. I gave part of the talk, and then I did a workshop with sort of repetitive dance, chanting and meditation, and one of the guys there had done a video of the Sand People in 1988 on precisely this. And he was totally gone. If you watch the Sand People on YouTube, he did exactly what they do. I mean, he was moving, and then all of a sudden he was down on the ground, he was gone. I mean, everything just stopped. Breathing stopped. So, in any case, it's a fascinating area. Right? And it has great potential for healing, assuming it's not done irresponsibly.
Could you expect somebody with the diagnosis of schizophrenia to take LSD, right? Have this go through the 4 phases, and come back with an improved default mode network, or an improved like a.
Groff did it with backward schizophrenics, yes.
Okay.
The only people he could not get to this to work with was people with obsessive compulsive disorder that would not let go no matter how much LSD he used.
I'm sorry. And the definition of backward schizophrenics. I'm sorry, I don't know it. You said backward schizophrenic.
Backward. You know, it's
Gotcha.
people that were locked up
Really
and they
bad.
were thought
Yeah,
they,
yes.
you know, they weren't going anywhere. Of course, this was the early 50s, and maybe Thorazine was around, but basically that was it. And they did use Thorazine and Ativan in between sessions, right? When they were like, you know, treating folks like this, probably Valium or maybe something else, Meprobamate or something. And Ativan was around. We use that now. But some other sedatives when people were like totally, they didn't finish the session, right? So especially when they were first starting off, they didn't know what they were doing. So nowadays, when they do these treatments, they have sort of a protocol on how to help people through these things. So with the breath work, I did 11,000 patients inpatient, and some had schizophrenic psychoses. They weren't paranoid. If they're paranoid, they think you're doing it to them and they don't know their process, right? So if they weren't paranoid, they could do this. Even though they'd been paranoid,
Sure.
and they'd decompensated on psychotics and they weren't yet out of the hospital, they could do this. They had the same experience as everybody else. There's no difference. You know, the whole idea that there's an objective psyche appeared to be absolutely true. That it doesn't matter what the personality stuff is, the psyche has the same objective psyche, the quote, collective unconscious, or whatever you want to call it, is the same for everyone. Whether they're schizophrenic or whether they're a normal, non-pathological, ordinary human being.
But then what does the default mode network look like a week later, a month later?
Oh well, I don't know that. That is being studied. There are studies about that. Certainly, it gets taken offline during the psilocybin treatment, and how, you know, I don't know whether that data isn't published. I don't know if it's sufficiently sensitive enough tool to say that this part of the default mode network is different or that or whatever. I don't know. However, there are genetics of this stuff too. Right? So one of the guys that got me to collect the data on holotropic breathwork in this inpatient setting was the chairman at Washington University. He was my supervisor when I was a resident, and Robert Cloninger. He's a big geneticist on alcoholism and sociology. He also has something called the Temperament Character Inventory, which is a biologically based personality instrument, and it goes along Erickson's stages of development, if you're familiar with those. And the 7th and 8th stage, generativity and integration, have their own genes. All the stages have their own genes in his framework. But integration is a non-duality. He actually talks about it in the introduction to his books on science of well-being, right? And generativity is being unselfish, naturally unselfish. Not an idea of being unselfish, like Christmas, oh, ringing bells, I'll give it to them. No, totally unselfish. Bodhisattva. You're no longer limited by your idea of your individuality, right? It's no longer like, you know, you're separate from the other individual, you're all part of the same body, ear, nose, eyes, throat, whatever. Right? So you take care of other people, which is a traditional Buddhist concept, right? Also Christian concept, also Sufi concept. I mean, it's all, the same concepts are found, right? Shamanic concepts, very simple. Right? I think
Cool, thanks.
As far as the refrigerator mother, did they tie that into any of that prenatal stuff, or is that completely separate?
well, you know,
Never really thought of the refrigerator mother at the point of prenatal. But I guess it could be possible.
sure, and not only that, you know, there are many. This is just one lens to look at this stuff through, right? There are other lenses. So, you know, there's methylation of the DNA or the RNA or the mitochondria, whatever, which gets passed down maybe up to 16 generations. So, you know, you may have the refrigerator mother already inside you before you're born. Right? It's not like it has to be, you know, some type of nature-nurture thing. It can be both, right? Or simultaneous. It's hard to say. In other words, we don't know a lot in psychiatry.
Yeah.
I got to certain Vikings inside
Well, I
me.
just got a,
Thank
I
you.
found a magnet.